Nutrition fuels our bodies and minds. Our strength, mobility, energy, and even mood rely on the right nutrition, and scientists are continually uncovering new secrets. Welcome to Nutrition Unlocked, the podcast celebrating innovations advancing the role of nutrition in health, sponsored by Nestle Health Science. In each episode, we'll talk to experts from around the world about the latest topics, and we'll bring you insights and discuss innovations that are unlocking healthier futures. Our host today is Dr. Chris Araujo-Torres, Head of Medical Affairs for Nestle Health Science in the U.S.
Welcome back to Nutrition Unlocked. I'm Chris Araujo-Torres, medical doctor, and I lead the U.S. Medical Affairs team for Nestle Health Science. Today, we'll be talking about a really hot topic that's affecting many people: how to manage your nutrition while using GLP-1 medications for weight loss. And we couldn't have a better guest to take us through this. I'm joined by Dr. Jamie Ard. Dr. Ard is Vice Dean for Clinical Research of the Wake Forest University School of Medicine. He's a professor in the Department of Epidemiology and Prevention, as well as co-director of the Advocate Health Wake Forest Baptist Weight Management Center. Dr. Ard is also the current president of the Obesity Society in the United States. Welcome, Dr. Ard.
Well, thank you, Dr. Chris.
So first, let's start with a general question, because I always find fascinating to understand why experts choose the field that they have. How did you come into the field of weight management?
It's an interesting origin story in terms of how I got into the field of obesity medicine. I actually, very early in medical school, got interested in this space because that was during the early 90s and people were just starting to talk about obesity. And I went to Duke for medical school, and there were a number of dietary residential programs in that area. And I had a chance as a student to work at one of them. It really became quite fascinating to me to see how dramatically someone's life can change and their health can change with weight reduction. And using tools at the time, all of the programs that we had in that space were really lifestyle oriented. And it was just amazing to me to see the changes that could happen with nutrition and behavioral counseling and physical activity. I just became enthralled with it. And I thought, there's not much in medicine that you can do that changes someone's life so dramatically from head to toe, inside and out.
Right.
And so, that's where it started. And I got involved in research, and I got an opportunity to hang out with some really great people who mentored me and allowed me to really work in that space and learn a lot, even though we don't get a lot in medical school about nutrition. I was able to spend time with registered dietitians and behavioral health professionals and learn a lot about the science as well as the art of practicing obesity medicine. And so that's where it started for me.
But I also know that weight loss can be very rewarding. Weight maintenance is very difficult. It's personal and it's individualized. So what keeps you in the field?
Well, this is really an extraordinary time to be in the field. And I think we're seeing more and more people come into the field because of the advances that have been made. But I think even before this sort of current period of discovery, it's been the individual reward of helping people, even at that one-on-one level, make changes that they thought were previously not possible. I just had a patient that I saw yesterday who, despite all of the transitions that she's experienced in the past year and the personal family challenges and struggles, she's still been able to improve her health and see significant weight reduction. And that's rewarding, right? At the end of the day, even if it's a bad day, that still makes me excited to see the next patient or work on the next project. And so that's what has kept me in the field. And I'm super excited about where things are going now.
We'll get to that because I have a couple of questions on that topic at the end. But
Okay.
So over the past year, we've heard so much about GLP-1 agonists. Everyone from celebrities to our loved ones are using them. Can you start us off by describing what GLP-1 agonists are and why they have become so popular?
Yeah. So it's a really interesting story if you delve into it. But at a high level, GLP-1 is actually a hormone that we produce naturally, right? It's what we call an incretin. So it means that when we eat something, then our body gets the signal that we've got nutrients in our stomach and we need to set off a series of reactions in terms of being able to digest that food and absorb that food. And GLP-1 is one of those hormones as part of that series of reactions. It tells the pancreas, okay, now it's time to produce more insulin. It also helps to slow down some of the digestive process, and it signals to the brain in terms of letting the brain know, yeah, there's enough food around and we can start to slow down on the eating. So it has a number of those effects, but it's something that's naturally produced. And over time, GLP-1s were originally developed for the treatment of type 2 diabetes because of that insulin effect that it has. And so it helps to lower blood glucose. But as those studies were done in people with diabetes, they noticed, yeah, these folks are losing a little bit of weight. And they're not really counseling them to lose weight per se. They're just starting to lose weight. And that's when I started to delve a little bit deeper and say, okay, yeah, there is a signal there when it comes to actually helping people reduce their intake. And so that's where GLP-1s for the treatment of obesity, that's where that science was born.
So we can say, quote unquote, that it was an accidental discovery regarding the weight management effect. That's interesting.
Yeah, it really wasn't the original intent in terms of development, because everybody understood when those medications were first introduced. Exenatide, for example, was one of the early ones. It was all marketed for, developed for the treatment of type 2 diabetes. But those of us in the weight management space also noticed our patients would come back and say, I'm just not eating as many carbs. I feel full early. That was often the comment. I just tend to leave something on the plate, whereas before I was a member of the Clean Plate Club, right? I was the president of that club and never left any food on the plate, no matter if I was full or not. And so that was a signal for a lot of us in the obesity medicine space that, oh, okay, these medications could be used off-label as a way to help some people who may not feel that sense of fullness as easily. That's where we might often use that.
So for our listeners, I want to share that when we say GLP-1 drugs, we're talking about liraglutide, which is Victoza or Saxenda, semaglutide, which is Ozempic and Wegovy, tirzepatide is Mounjaro and Zepbound. And there are others, as you were mentioning, that were in the market and are in study. But in general, we're going to refer to them as GLP-1 drugs in general. So can you describe how these drugs work? Specifically, what is that people on GLP-1 drugs experience both physically and psychologically?
It's a really interesting phenomenon in terms of talking to people who are taking one of these medications, and especially if they have a type of obesity that is particularly sensitive to this treatment type. One of the things that people will first notice is that they just think about food less. They will just say, yeah, I'm not preoccupied with food. I tend not to really think about when my next meal will come, or sometimes I have to remind myself to eat. So there's a general sort of decreased attention to food or focus on food. And for those people who tend to have that high attention bias towards food, that is really striking for them, right? So these are people who will always know what's in the break room to eat, right? They will know if there is something around that they might like, that it's hard for them to not focus on that. And so these folks will tend to find that, I just don't think about food as often. The other thing that will happen is that for most people, they will start to have a sense of early fullness. So this is what we call satiation. So they get to a point where they feel full early, and that may be related to two things. One is just the delayed gastric emptying. So the stomach fills up faster and takes longer to empty. But the second thing may be related to the action in the brain and the areas of the brain where GLP-1 receptors reside. Those areas of the brain tend to control appetite and energy intake and help us sense fullness. And those receptors being activated make people generally consume less. And it's through that mechanism of just feeling full early. So those are the two things that people will most often notice as almost immediate effects very early on, even at low doses. And I think those are the things that really contribute to that sense of, or the ease of weight reduction that happens with these treatments. Now, you mentioned psychologically, what's the impact? Well, I think a lot of people will feel a sense of relief of, okay, so I wasn't crazy. This
Right.
idea of, I knew something was different for me when it comes to managing food and dealing with the food environment. Maybe I just thought, okay, it's just my burden to bear, right? It's just me not being strong enough or not having enough willpower. And then when they have this sort of light switch moment, they take this drug and then they don't think about food as often. A lot of people will come back and say, oh, I see what normal feels, right? It's the sense of I'm unburdened from having to think about and deal with food all the time. So there is definitely this sense of relief that can happen when people get that effect. And I think for a lot of people, what it does, it just cognitively frees them up to put their time and attention elsewhere, right? One of the things that we've always had to do when it comes to weight management is have people really pay attention to and focus on self-monitoring and what are you eating and when are you eating and counting calories and things like that. Now that just becomes something that you do to help people develop a better pattern, but not to actually achieve a calorie reduction because that calorie reduction is happening normally.
What comes to mind when you were explaining all of this is control. I can imagine that a sense of control that patients and individuals on these medications are experiencing is just phenomenal. So I heard from your explanation, they significantly reduce their appetite. In some cases, they just don't think about food. But at the same time, they still need the right nutrition for their bodies to function as they should. So what can people do to ensure that they're getting enough of and the right kinds of nutrients? Which are those important nutrients?
The most important piece of this is actually working with a good healthcare team to make sure that you're not just taking the medication with the hopes that, okay, that's going to fix everything, because the medication is really a tool and it's really a powerful tool, right? So it can create a sense of very strong appetite reduction that can, if not appropriately addressed, lead to unintended consequences. So I think it's really important for people to think about some type of structured approach to eating so that they're not relying on an internal cue that may be absent or diminished. Normally, we eat based on a sense of hunger and fullness. And when we get to a certain level of hunger, we know, okay, it's time to eat. And then we get to a certain level of fullness and we stop. And so if you've diminished that sense of hunger to the point that it doesn't happen naturally, now you've got to then give yourself an external cue. Okay, well, I'm going to use a time cue, for example. It's 3 hours since I had my last meal or snack, my last eating episode, so I'm going to have a small portion now. And I think that helps to get people on a better calendar or cadence of eating, because the goal is to get the right amount of nutrition in. And those nutrients that we think are really priority are going to be protein, healthy fats, and then fiber, and all of your minerals and vitamins are part of that core. Here's what we know will lead to good sustained health. And mostly what we're interested in doing is helping to preserve lean body mass that includes skeletal muscle and bone when people are actively losing weight, because these drugs don't specifically target fat. And that's important for people to realize. It's creating this total energy reduction. And if you don't take in enough of the right nutrition, then you put your lean mass, muscle and bone, at risk for being used as a source of energy or to make up deficits in things like calcium if you're not taking in enough to support those tissues when you're actively losing weight.
So when you say protein and healthy fats and fiber, prioritizing your vitamins and minerals, what does that look like throughout the day?
For different people, it's different things. And some of that is going to be predicated based on, well, how strong of an effect is the medication having for you, right? So everybody's different. Some people will have a very strong effect at low doses. Some people don't get the full effect to higher doses. Some people never get the same severe reduction in appetite. So that's what we're looking at first, is what sort of capacity do you feel like you have to take in a certain amount of food without feeling nausea, without having any kind of GI side effect. And so we also have to think about the stage of life, all right? So that makes a difference if you're younger, premenopausal female versus a postmenopausal female who is in her 60s or 70s. There are different considerations in terms of risk of lean mass loss and the impact of that loss of lean mass. The amount of weight loss that you're trying to achieve, that's also going to have an impact. So there are lots of different considerations, whether you've had bariatric surgery before and you're now dealing with some weight regain and you already had a malabsorptive procedure like a Roux-en-Y gastric bypass. So we're taking all of those things into consideration as we're trying to put together a dietary prescription for people. And that will then inform, okay, well, what form of the nutrition do we need to consider? Is that going to be a meal replacement? Is that small, frequent meals and snacks throughout the day? What's the structure of that? Is a combination of meal replacement plus food? All of those things are part of the calculus as we start to think about tailoring a dietary strategy for an individual.
But I would think that in general, all dietary patterns work. And when I say dietary patterns, is people that are vegetarian or people that are predominantly on a ketogenic type diet, lower in carbohydrates. It works with all dietary patterns. Am I correct?
Yeah. So ultimately, the dietary pattern that people can implement is the one that is often the best one to start with. And then what we want to do is look at the nutritional completeness for that, or what are the gaps, and then how do we supplement in order to address those gaps. So you mentioned a vegetarian pattern. Often for females, they're not going to get enough iron in that pattern. So we might need to supplement that and think about the impact of the supplementation on their bowel regimen and so forth. But all of those dietary patterns, whether it's a DASH pattern, a Mediterranean pattern, a low carb type pattern, vegetarian style, all of those things can work. And it's just a matter of being able to think about how to marry the personal preferences with cultural preferences, with the dietary needs and the stage of life, and put all that together.
Yeah, to me, it comes back to the sustainability of the weight maintenance is doing what you can do and what you can sustain for life. So those need to be taken into account. You briefly mentioned about the side effects. You mentioned about nausea and some GI effects. And we know that some patients experience these either from the medication or potentially the rapid weight loss. What can they do about it?
I think this is, again, where working with a qualified medical professional to help really address these issues and not just ignore them and try to work your own way through those issues. I've seen plenty of news reports that look like that's the case, where people didn't work with someone who could have helped them mitigate long-term side effects. So I think there are a few really important basic concepts. One is the type of food that you eat while on treatment is going to be really important. If you're eating high-fat foods, greasy foods, oily foods, things like that, that might already increase your chance of having reflux, it's only going to get worse with these types of medications, spicy foods, whatever it may be. So if you have a tendency towards gastroesophageal reflux, then this may only make it worse. And so you want to choose foods that tend not to exacerbate that. You also have to be really careful about the portion sizes, right? So this category of medications will make it, again, such that you feel full early. And the difference between feeling nausea and feeling satisfied could be a couple of bites. So we encourage people, take your time, eat slowly, give yourself a chance to really sense that fullness coming on and be prepared to stop. And sometimes it takes a little practice for people if they've not really experienced that before. The other thing that is really important is just having a good bowel regimen. We might often, especially if people tend towards constipation, say, look, we're going to use a fiber supplement plus something else polyethylene glycol to really, on a proactive basis, keep things moving. If people tend to have more loose stool diarrhea as a side effect profile with GLP-1 therapy, then fiber still can help in terms of bulking. But we want to be, thinking about how to manage those GI side effects. And they're often dose dependent, but over time, your body does get accustomed to the dose that you are maintained on. So those things can be managed. And again, working with a healthcare professional, you can decide what co-therapies are necessary in order to mitigate the negative effects of treatment. But also, what's that balance, right? If I've got to take 2 medications to be able to allow me to take this one medication, is that worth it for me? Or is there an alternative that would be better that gives me a similar effect, but without having to take 2 other medications just so that I can tolerate it?
Right. So I'm hearing that in the presence of appropriate medical counseling, you can eventually choose what's the best option for you.
Yeah, absolutely.
So in general, what are the recommendations, even outside of GLP-1 agonist uses, what are the recommendations that you give to people that are trying to develop healthy behaviors while losing weight? What should they do?
I think there are a lot of basic common sense general recommendations that we like to incorporate into our treatment strategies here in our program. We talked a little bit about this earlier, but the idea of eating on a regular schedule, I find to be really important because we know that appetite control is related to the sequencing of eating events. And what I mean by that is that if you eat a meal and then 3 hours later you are hungry, and that's a normal cycle of hunger and fullness for you, then eating at that time in that 3-hour window means that you're more likely to be in control in terms of portions and choices versus if you wait another 2 hours or another 3 hours, the longer you go, the more hungry you get, the less consistent your choices are, the harder it is to control your portions. I think there's plenty of research that suggests that when you are mindful of those eating episodes, you tend to be in better control of your overall nutrition. There's a lot of conflicting data about the number of times that you need to eat per day. And I think that research is some challenges with it. But clinically, what we find when people are trying to better manage their intake, if they are more structured in their approach to food, they generally do better. That also means that they're more thoughtful and mindful about eating and what they're doing, right? So I make a rule with a lot of my patients, like, all right, no eating in the car, right? If you have to eat in the car, then you need to stop, go inside the restaurant or pull over or figure out a time where you can actually be mindful of what you're doing rather than being distracted, right? The ultimate distraction of driving. So there's some of those sort of basic things that we really preach that are really about that relationship with food and trying to help people change that and modify that in a way that, as you talked about before, leads to a sustainable approach to food that can be useful for weight loss, but also weight maintenance. I think one of the things that we think about when it comes to helping people make a dietary adjustment when they're on a GLP-1 based treatment is that you have one of 2 options. You can just eat less of what you were already eating, and that may be okay for some people if you had a healthy dietary pattern before you initiated treatment. The alternative is that you might need to change the types of foods that you have been eating to adopt a healthier dietary pattern. And that probably is the majority of our patients that we see, is that we're making some of those changes. What we do is we try to prioritize protein first because we know protein is going to have an important role in helping to maintain skeletal muscle, lean mass, including helping with bone mass. And so we're going to recommend that people take in high protein foods. So that's lean meats, fish, poultry, dairy products will often be a good source of lean protein. Eggs will often be a good source of protein. For those who are doing a vegetarian pattern, tofu, tempeh, those types of things, soy products will be a core part of that. protein, meeting those protein needs. Beans and rice, the complete protein, can be had that way as well. And then we think about healthy fats. So we are very much proponents of incorporating things like vegetable oils, so olive oil, canola oil, etc., into a healthy dietary pattern. That can also include nuts and seeds, where you're going to get a lot of healthy fats, nut butters like peanut butter, etc. So those are going to be key core components. And then we want to next add in fiber and make sure that we're trying to get as much fiber as possible. Often that can be hard to do through the dietary pattern alone, especially when you've reduced the overall intake, and fibrous foods tend to be bulkier, so people tend to get full faster. So we're kind of monitoring that, but that's going to be your vegetables, and fruit will be a source of fiber, and whole grains, right? So you're covering a lot of the healthy food groups. I'm not such a nihilist about, well, it needs to be unprocessed versus whole foods and that type of thing. I think you do what you can do in terms of time, convenience, and access to foods. If you find a processed portion control meal that has vegetables and a whole grain product and healthy protein, then that's a good option. I think it's the ultimate nutrition that I'm looking for in the first place. And then when there are gaps in terms of what we can reasonably get in from foods, then that's when we're going to use supplementation. So mineral vitamin supplementation. Often it's calcium, iron, vitamin D, those types of things. But often the basic recommendation is for a good multivitamin.
So I would be remiss if I didn't ask you about hydration and physical activity.
Yeah.
Because we hear so much about it, so conflicting information. There's been recently reports about aerobic exercise does nothing for you. It's all over the place. What are the recommendations in general that you give individuals regarding their hydration and their physical activity?
On the hydration side, we don't necessarily have a hard and fast where you have to get, 64 ounces or 8 glasses of 8 ounces every day. But we do try to give people a sense of, you have to be aware of your hydration, because GLP-1 therapy in general, or in particular, can actually decrease people's sense of thirst. And so just the same way you don't feel that sense of hunger, a lot of people will look up and say, well, I had nothing to drink most of the day. And so, again, that's one of those things where we have to have some external cues often to prompt people to make sure that they're getting in adequate hydration. I like to tell people I want at least half of your intake to be regular water. If you want to drink unsweetened beverages, coffee, tea, totally fine with that. I want you to think about what your intake is. I don't want you to force water intake and then have to stay up all night going to the bathroom, right? That's not going to do you any good. But there's a balance there in terms of what target intake should be. If you're more active, if you're working in outdoors in a hot environment, those types of things where you might have more insensible losses, then we're going to ask you to take in more fluid. On the physical activity side, our recommendations are consistent with a lot of the guidelines, in that during active weight loss, we're targeting about 150 to 180 minutes per week of moderate intensity physical activity. And we want about 2 sessions to 3 sessions of strength training per week as a part of that, large muscle groups. And the intent here is not to, really accelerate the pace of weight loss per se, because the evidence does show that just exercising more doesn't necessarily lead to a greater amount of weight loss, especially for women. But what we do know is that exercise from a weight management standpoint has really positive benefits for body composition. And so that goes back to what we were talking about earlier in terms of maintaining lean mass, muscle and bone, skeletal muscle and bone. That physical activity is going to have a positive impact there. And in the longer term, we believe that it has an impact on your ability to maintain your weight loss, because you have more tissue that's around, that's burning calories, that's metabolically active. So there's sort of an investment, if you will, for physical activity during that active weight loss phase. It's an investment in the long term to ensure that the quality of weight loss is going to be what we want it to be. And I think aside from all the other benefits of physical activity, from the cardiovascular health side of things to mental health and quality of life, these are all the other reasons that people should be doing physical activity. But as it relates to weight management, that's what we recommend.
Well, I love this idea of physical activity as an investment, because when you are not currently doing physical activity and you ought to start, it's always hard.
Yes.
So if you think of it as, okay, this is something that I'm going to progress and it's really going to pay off, even if it pays off later, that can really be stimulating for people to engage in physical activity. So finally, what do you think is the next big thing to come in weight loss management?
Well, I think there are a couple of really exciting things that are in the pipeline. We're going to see continued development of different targets. So we'll be talking about GLP-1 based treatments for a long time. I do think that we will see new targets that are not GLP-1 based that have different mechanisms of action, different modes of action and administration. So, what I'm talking about might be, say, a once monthly treatment versus, even once every week now, right? I mean, that's sort of mind-blowing to think that we could have something that you only have to take once a month, and it's going to have this great impact on your body weight and ability to help with that control of eating. There are a lot of really interesting products in development that I think are going to continue to accelerate this revolution that we're in now. I think the other thing that will happen as we develop more of these targets is that we will shift from just thinking about total weight loss to the quality of weight loss. And I think that will be made possible through some of the work that's being done now with molecules that target muscle and actually increase muscle mass during active weight loss and preferentially help with the loss of fat mass so that you have a greater improvement in body composition for the same amount of weight loss. And that will help us move the field forward beyond just obesity is an excess amount of weight to we're actually treating excess fat mass. And we are changing how that thermostat is regulated, allows for the accumulation of that excess fat mass. And that's going to lead to even better outcomes long term. It's also going to allow us to be able to treat patient populations like those who are frail, older adults, those who might have sarcopenia, those who don't have the capacity to do physical activity as a part of their regular treatment plan because of other problems like rheumatoid arthritis or MS, or they've got some other end organ damage or joint dysfunction that makes it hard for them to be physically active. And so we could actually have a solution for that in terms of preserving lean mass while still allowing them to lose a significant amount of fat mass. So I think those are some of the really interesting developments in the field and will take us forward in ways that probably right now we can't fully appreciate.
Fascinating. I was thinking of all of those that have mobility issues and how that can be really a game changer.
Yeah.
So yes, cannot come soon enough. I agree. Dr. Ard, I cannot thank you enough for being my guest today and sharing your knowledge on this topic that is so relevant and current.
Thank you so much for having me. I appreciate the invitation.
To wrap up, I just want to say a big thank you to everyone for tuning in. I hope you've enjoyed this episode of Nutrition Unlocked, and if you haven't already, please subscribe so you don't miss an episode. See you next time on Nutrition Unlocked.